In children of a mean age of 4, the disease is shorter than in adults. Although with varying degrees of severity, the symptoms of onset were similar as in adults, and interstitial pneumonia occurs in most cases. The worsening of respiratory performance may prolong the hospital stay up to 13 days, but only one child out of 6 was treated in the intensive care unit. In a retrospective analysis of 38 pregnant women, the infection did not cause maternal death or abortion. No transplacenta transmission occurred and the fetus was not affected. In pregnancy, the clinical features of interstitial pneumonia are not remarkably different from the standard as of adults. Carr demonstrated that treatment with lopinavir-ritonavir, commercial name Caletra, added to standard support therapy in COVID-19 severely ill patients, caused neither clinical improvements nor mortality reduction. In the same trial, the viral load did not decrease in comparison to the control group. 14% of treated patients did not complete the full 14-day course, mainly due to gastrointestinal adverse reactions, including severe acute gastritis, nausea, abdominal pain, and diarrhea. Moreover, Caletra may often bring severe side effects of liver damage, pancreatitis, skin rashes, and prolongation of the QT interval in the electrocardiogram. About other drugs with various mechanisms of action, at the moment, no validated data recommends their use. Synchronous clinical televideo consultation to the home isolated patients is of some support to the general practitioner. It's him, the one who requests such healthcare service, while providing the patient's contacts to the clinical consultants. One of these internal medicine specialists gets in touch with the patient or his cohabitants by telephone calling and typically schedules a meeting on a video conference platform via internet. Thereafter, the clinical teleconsultations take place as often as once up to 3 times per day. During these video conference meetings, 1. The clinical history of each family member is traced. 2. The clinical trend is monitored with a visual examination. 3. Recommendations, including therapy and instructions on the use of medical devices, are given, sometimes upon the support of multimedia tutorials. In the treatment of COVID-19 affected patients with some degrees of respiratory distress, it was possible to administer oxygen therapy at medium and high flows, 5-15 liters per minute, through the prescription of free of charge 3,000-liter capacity cylinder by the general practitioner. In the follow-up, the televideo consultation had also to realize whether positive hand expiration pressure ventilation was needed, and therefore hospital referral mandatory. During clinical televideo consultations, 2 variants of COVID-19 clinical picture were observed. 1. Flu-like. 2. Onset with diarrhea. The first one is characterized exclusively by general and specific symptoms of a high fever, muscle pain, fatigue. The second one is characterized by diarrhea, abdominal pain, marked ageusia, and anosmia. Late appearance of only moderate fever. Actually, the percentage of detection of COVID-19 in the feces is reported at 29% of the cases. Either variants turn out to be identical from the 5th to the 7th day on, when interstitial pneumonia causes irritating dry cough. The interstitial pneumonia may either recover or evolve to dyspnea due to hypoxemia, to be challenged by oxygen therapy at home. In an unfortunate 6% of cases, the interstitial pneumonia may develop an acute respiratory distress syndrome to be referred to the intensive care unit of the hospital. These computerized tomography images belong to the first case reported by the Spallanzani Hospital in Italy. Mediastinal lymphadenopathy and tubular aspects with sudden narrowing of the segmental branches of the lung vessels may occur. Spots of interstitial pneumonia may appear downstream of such vessels. The case experienced in the Spallanzani Hospital suggests that the secretions of the patients are contagious no longer than 30 days. However, a zero-contagiousness sunder is needed in order to establish the patient's full recovery. Will swabs or the detection of IgM and IgG antibodies be more useful? To restrain the epidemics, the curves of social distancing suggest that if the measure is not kept up for an adequate time, a rebound in the number of new infected people is inevitable. Indirect contagiousness of biological materials lying over porous surfaces was evaluated with cellular culture studies. The halving of the viral load occurs in 2-7 hours, while the complete removal takes from 4 hours for copper to 72 hours for plastic. We may say that after 24 hours, all the materials are not likely to be contagious. In Italy, all over the Bergamo municipality, the management of COVID-19 became a case studied by the New England Journal of Medicine. The excess of hospitalizations of COVID-19 ill patients, the clinical teleconsultation system could have successfully taken care at their home of, has 1. Occupied all the hospital beds. 2. Facilitated the spreading of the disease. 3. Strongly reduced the access to the first aid department. No attendance and response were given to other non-COVID illnesses. So questions arise. Why have the previously long waiting lists for examination and hospitalization been emptied so quickly? Were such demands unnecessary? How can we challenge the illnesses other than COVID-19 through such disrupted healthcare system and resume the habitual performance in the near future? The lesson learned from these epidemics is that televideoconsultation can strengthen the primary healthcare system by ensuring the minimum of movements of the patients and, in the meantime, protecting the health workers' safety. Thus, fewer hospitals and more primary health care are supposed to efficiently manage both epidemic acute illnesses and chronic diseases.